Welcome back to Melisia Talks, where we talk all things uniquely you. For the month of May, we have been highlighting Nurses Month. That is right. Nurses, whether you are a licensed practical nurse, a registered nurse, a nurse practitioner, you are being loved on and celebrated this month. We had a specific week, of course, for the month. That was last week, which is May 6th through the 12th. But overall, as I said before, be sure to love on your nurses. We do a lot. And to think about it, it's not just our nurses here in the United States. I have to keep that in mind. Every country, or pretty much every country, we do have, of course, there are, nurses in various aspects, whether or not they, have the same type of autonomy that we have here in the United States. Every country will vary, but overall, if you know someone that is a nurse, celebrate them and give them some love this month. Now, we have been looking at your nurse practitioners this month and all that we can do to help you and service our communities. The first week, we looked at social determinants of health and how nurse practitioners play an integral part in that and helping overall bring awareness, advocacy, and so forth to our communities and our societies as a whole. And then last week, we looked at our nurse practitioners and how we can help with chronic disease management. Now, for this week, I would like to highlight, because it is also Mental Health Awareness Month, I wanted to look at our nurse practitioners that are considered psychiatric mental health nurse practitioners. And of course, this is specialized as well. And so these nurses are able to, assess, diagnose, and also treat various patients with mental health issues or disorders. And they can also manage their medications and also provide counseling and psychotherapy. And so, again, I do want to ensure that everyone understands that if you're dealing with anything, there are various resources out there to be able to receive help. We do have our National Institute of Mental Health, that we also have National Alliance on Mental Illness, and even Mental Health America. And if this includes a substance abuse issue, we do have Substance Abuse and Mental Health Services Administration as well. I did have the opportunity while completing my doctorate to look at a study regarding nursing students and depression and how that can be seen throughout the program. If, of course, you have a diagnosis of this, make sure you continue to seek help. But we do understand that some of this, as it relates to depression, can be situational. And so we want to make sure we keep that in mind. And that was the overall goal in helping students to recognize that you're in nursing school. It's going to be a lot. It's going to be challenges. It's going to be a lot of mental toughness and mental drain as well. And it can be seen in ways of such as depression or even anxiety. And so, again, recognizing that this is potentially situational for you and getting the help that you need. And so, we were able to collaborate with our student services department where I work to be able to send those students, if they wanted to get that service and that help that they needed during that time frame while in nursing school. And so, again, keeping that in mind, that is something that I was able to do. And it was a great opportunity, a great learning, tool for myself and also the faculty that I worked with during that time frame. And so, definitely keeping that in mind. If it's something that you have diagnosed, continue to ensure that you get the treatment. But we do understand that there are some things that can be situational, and making sure that you get help during that time frame as well. Now, briefly back to your psychiatric mental health nurse practitioners, I mentioned some of the things that they can look to do to help. So overall, I talked about that diagnosis and treatment. That includes evaluating your patients, looking to diagnose such as our issues such as, anxiety and depression, even PTSD, which is post-traumatic stress disorder, also schizophrenia, and looking to develop that personalized treatment plan for that client. They can practice autonomously in some states. And so you want to ensure that you're understanding if this is ever something that you would want to do, or you are, being seen by an actual psychiatric mental health nurse practitioner, that they could be practicing autonomously or independent of an actual physician. So, again, checking your state is going to be key when it comes to that. But some states do require that they are collaborating with an actual physician. So, make sure you understand that when you are seeking care or if it's something that you would like to do in the future. All right, so I mentioned, of course, medication management. And again, that also depends on state regulations. And so, again, keeping that in mind and making sure that you understand what that state allows and what they do not allow. And these medications we know can help with symptom management that your clients might present with. I mentioned psychotherapy and counseling. This can provide therapy sessions to help, this client develop coping strategies, also look to improve their overall mental well-being. It's not all about just medications that you're going to take. A lot of it has to do with the mental aspect and looking to improve that and giving them strategies to help with that. We do, again, know medications are there, but a lot of times, if we can help our clients with psychotherapy or just counseling prior to that, we would look to seek out that route first. Also, they can provide holistic care, which includes various factors such as sleep hygiene. A lot of times, people don't realize that lacking sleep or not having the proper amount of sleep can also mentally be taxing, especially if you have an issue already potentially diagnosed or situationally taking place in your life. You want to make sure that sleep hygiene is key, nutrition as well, and even finding various ways for relaxation techniques. And that could look like deep breathing, that could look like, potential meditation, that could look like, aromatherapy. There's so many different things that can be done. So your nurse practitioner can look to provide that holistic care for you and also looking to emphasize on those lifestyle factors and changes that can overall help your mental health. And then when it comes to access to healthcare, we've mentioned that already when I talked about your social determinants of health. But when it comes to mental health professionals, these nurse practitioners can help close the gap, right? Especially in those underserved communities, especially in those rural areas where we do not have that access that others in a large urban city may have. So these nurse practitioners can help bring that, gap to a close and also be the wherewithal there when there is a shortage, because we do know, as it relates to psychiatrists and even psychologists and even primary care providers, there is unfortunately a shortage in those areas. And so these nurse practitioners can help again come to bridge that gap. I did mention, of course, these providers, your psychiatrist, your psychologist, and also being mindful of your primary care providers. We all can collaborate to work together to be able to ensure that our clients have a comprehensive plan. Overall, we're there for the client, we're there for our patient. We want to make sure that we work collaboratively to ensure that this client have all that they need to have this comprehensive treatment plan together that will help them be successful overall. And so if you're deciding to, work in this field, there is a growing demand. I just mentioned that there is unfortunately a shortage in many of our provider aspects. And so you would be the one to help close that gap. When we talk about our various mental health disorders, unfortunately, we are seeing them start much earlier when it comes to age ranges. And so because of that, you are needed. You are needed to help close that gap. And so understanding that overall, unfortunately, because we are seeing, and it's a lot, I'm not going to give out percentages here because this is not my area. But again, I just want you all to understand that, and you all know and can see now in our society, we are seeing that unfortunate age lower when we talk about clients presenting with mental health disorders. And so we want to ensure that we're able to close that gap. So again, overall essential for children, adolescents, and adults as well. And so just something I wanted to, point out here as it relates to now this month also being Mental Health Awareness Month and understanding what that psychiatric mental health nurse practitioner can do. Again, this is a very specialized role They do, just like any of our other specialties, go through training to have this specifically, apply to their credentials and also certification. They will take a separate exam to be able to assist with this. Even if I chose to go back to school to do this, it would be more classes that I would need to take. And I think it's about a year and a half that I would need to, go through schooling to have this added on to my certification. And then, of course, test for the actual certification, and also be mindful of the various state regulations as it relates to psychiatric mental health nurse practitioners. So keeping that in mind and understanding that your nurse practitioners, once again, can do a lot. Keeping that in mind. And so this is all that I have for today. Tune in next week for another overall topic that we'll talk about as it relates to your nurse practitioners and what we can do for you. We are here to service and also provide that overall care and holistic care to our community. So this is Melisia Talks, where we talk all things uniquely you for the month of May. Until next time, bye.